Hello and welcome to my channel. I'm glad you could come here today and take some steps to take charge of your health. So my name is Cynthia and I'm a licensed acupuncturist in Ontario, Canada. And what I want to show you here today are some great acupressure points that can be used in the treatment of bronchitis. Bronchitis is an inflammatory condition where the airways of the lungs get filled up with phlegm. Normally, when something irritates our airways, we will cough as a way to get rid of the offending substance. In the case of bronchitis, the cough is a productive cough, meaning that we're coughing up thick mucus, and that the small hairs called the cilia, which are in the airways, and that would normally be moving the phlegm out of the lungs, are not doing so. Bronchitis may be caused by a common cold that is often felt deep inside the chest, as we would often call this a chest cold. It may also be due to irritants in the air, such as smoke, smog, paint fumes, dust, asbestos, or many other chemicals. The bronchial tubes then become inflamed and swollen, which constricts the tubes, making it harder for you to breathe in, which then leads to fatigue. The bronchial tubes also release mucus as a way to clear out the offending substance through a productive cough. The Oriental Medicine perspective on the lung system is that the lungs are called the delicate organ because they are exposed to the outside and they are vulnerable to external pathogens. So this can be anything in the air such as bacteria, viruses, or pollution. The lung system may also be weak because of a predisposition within the family. Lung illnesses in childhood, such as asthma, or past exposure to air pollutants. Symptoms of chronic bronchitis include coughing with mucus, wheezing, shortness of breath, tightness in the chest, or feeling tired. If you experience more serious symptoms, such as high fever or coughing up blood, it's recommended that you go see the doctor. Acute bronchitis is often a result of a viral infection in the respiratory tract, and this will usually resolve on its own within about 10 days. When it comes to chronic bronchitis, the coughing goes on for a long time, specifically 3 months or more, and on and off for 2 years. Now, whether your bronchitis is acute or chronic, you can benefit tremendously from Oriental Medicine with the use of acupressure. So let's go through some of the points used for bronchitis. So this first point here is called lung 5. We're going to find this at the elbow crease. That's called the cubital crease. So this is on the inside of the arm, and this is a point in line with the thumb. So we're just going to locate the tendon of the biceps brachii right here. And then just going on the outside of that tendon right here, this area is called lung 5. This point works to regulate the flow of air in the lungs so as to stop coughing. The functions of lung 5 are to clear lung heat, think inflammation, and expel lung phlegm. So phlegm, think like mucus. Lung 5 treats symptoms such as cough, asthma, hemoptysis, that means coughing up blood, afternoon fever, chest congestion, and sore throat. Now this next point is called lung 1. This point is on the upper lateral chest. Now the best way for you to find this is you're just going to raise your arm up to shoulder level, and then you can just feel below the collarbone is what we call the deltopectoral triangle. Just under the collarbone, where the collarbone and the shoulder meet, you'll find a big depression, and that's called the deltopectoral triangle. Now that actually is lung 2, so we're just going to hold our finger there, and then we can put our arm back down. And now you're going to take your thumb or your finger, which is just below your collarbone, and you're going to go about 1 thumb width below that, and that is called lung 1. This point is often tender on people who have lung issues such as asthma or pulmonary tuberculosis. This point functions to disperse or eliminate the fullness and stuffiness of the chest. It also strengthens the lungs as the first point on the lung channel. There's quite a lot of energy there. And it improves circulation in the upper body. It's a great point for coughing and resolving phlegm in the chest. So treating conditions such as bronchitis, asthma, wheezing, and chest pain. It's also good for any chronic lung issue. The lung system can also be weak for emotional reasons, namely the emotion of grief that is either suppressed or is being overexpressed. The lungs can be weakened when this emotion goes unresolved, and so it's an important piece to look at when we're dealing with lung issues. The next point here is on the front of the lower leg, a point called stomach 40. So this is on just near the tibia bone, halfway down the tibia bone. So the best way to find this is we're going to put our pinky finger on the external malleolus and just stretch our hand out, and then our thumb is going to drop down onto this tibia bone here, and then with our other hand we're going to put our pinky finger on the knee joint and bring our thumb down. So our two thumbs are going to be pretty close together here, and this is the halfway point along the tibia bone. So this is where you're going to go. Then from this point you're going to go one thumb width lateral to this crest of the tibia bone, and that point is called stomach 40. This is a great point for resolving phlegm anywhere in the body, just a great phlegm point. And it's also the connecting point to the spleen channel. Now, when the spleen system is weak, it leads to unresolved phlegm in the body. And this excess phlegm then gets stored in the lung system. Okay, now we're going to look at another point on the stomach channel. We're going to go further up this tibia bone here to a point called stomach 36. It's actually found 4 fingers below the base of the patella bone. It's your kneecap. And also 1 finger breadth apart from the lateral to the tibia bone. And this is a great point for chronic cough that resists treatment. This point strengthens the spleen, which is a channel that supports the... And then we're going to find our next point located on the base of the neck. So going to the level of your collarbone, where the 2 collarbones meet, there's a little divot in here. And so this is midline of the neck. And this area is called the suprasternal fossa, so right in the center here. And we're going to be pressing downwards in this space. This point is called conception vessel 22, and it's used for cough, asthma, chest pain, and anything related to the throat, such as sore throat, sudden hoarseness of voice, goiter, difficulty swallowing. Okay, so you can give acupressure here a couple of minutes at each point. And for the arm and leg points, you're going to do both sides, a couple minutes on each side. It's also important that you drink plenty of fluids and get lots of rest if you have bronchitis due to infection, just to support your immune system. And in the case of excess phlegm, it's important to reduce or avoid consumption of foods that create more phlegm. These include sugar, dairy products, wheat, peanuts, bananas, and an excess of raw, cold-natured foods. So thank you for joining me here. I hope this has been helpful to you, and I look forward to connecting with you in the next video.